So hi everybody, it's me, Celeste and Adele.
Hi.
We are so grateful and honored to have amazing Shani here. She is an EDS specialist, and this is really a topic that we feel is so important because we started Hypermobile Yogis, and this huge influx of people came to us going, what about information for EDS? And we really did feel out of our depths. So we are beyond honored right now to have someone who can really educate us and take our knowledge further, especially to support the EDS community, which I don't know if they're always given the support they need, but I think, Shani, you're going to be able to elaborate on that actually a little bit more and tell us, can you just actually first start by telling us a bit about you and your background and a little bit about your history into how you came to work with the EDS community?
Sure. I have, well, let me back up. For those that don't know, there are over 13 types of Ehlers-Danlos syndromes. And there's also hypermobility spectrum disorders in addition to that. I have the most common EDS type, which is hypermobile EDS. I actually was not diagnosed until later in life. I, like many people with hypermobile EDS, have always been very flexible, very hypermobile. And so you can find many of us in our childhoods, in our teen years, in gymnastics gyms, in dance studios, in yoga studios, and other places where our hypermobility is really valued. And so I was not diagnosed until I was 40. And part of that, a large part of that, is because a lot of the medical community are also not aware of these conditions. Mm-hmm. And so while I was going to various doctor appointments, the doctors I was seeing did not know that EDS existed, and so were not able to identify that was the condition causing my symptoms. I used to be an early childhood special education teacher. My symptoms started becoming more life impacting, and I was not able to continue my career. It was about that same time that I discovered actually myself Ehlers-Danlos syndromes, and I took that to my doctor and said, is this possible?
Wow.
And I immediately started trying to read everything that I could about this condition, wondering, what is this that I have? I joined at that time at the EDS organization's message board, and I saw that people were asking questions that I knew the answers from all my readings. So I would answer them. Within about 6 months, the organization reached out to me and asked if I would join and help them in a more formal capacity. I am now, let's see, this is 8 years later. I'm the patient and community educator for the Ehlers-Danlos Society. I manage the helpline emails that come in from doctors and patients from all around the world, as well as moderate our message board on Inspire. And I also attend conferences and do patient advocacy work with the government and medical schools and places like that. I guess I should have mentioned too, if you can't tell, I'm in the US and I live in Maryland with my husband and wonderful children.
Wow, so you are quite used to getting lots of questions from people that have just discovered that they've got this condition and what they should do about it.
Right.
This is particularly interesting for us because this is kind of the situation that we're in right now. We've created our Instagram page, and we're getting so many messages from people saying, oh, thanks for your page. I've just realized I'm hypermobile. But then it's kind of like, what should I do for my elbows, or what should I do for my ham,
Mm-hmm.
or this kind of thing. So what do you how do you deal with all of these kinds of questions that people get? And I'm sure that so many of them are very individual questions.
They really are. But if I could just take a moment, about 20% of the population, give or take, for age and ethnicity is hypermobile, whereas 1% or less have a type of Ehlers-Danlos syndrome. So just because you're hypermobile does not automatically mean you have a genetic condition. So,
mentioning that,
Yeah,
actually, I
very
think
important.
very valid point. And yeah, I think it's a bit like when everybody had gluten intolerance, suddenly everyone became celiac. So I
right.
think this is a very important to share. Those statistics are incredibly helpful.
Thank you. But to answer your question, how do I answer so many varied questions from people? For many, there are common questions that will be asked. How do I get diagnosed? Pain is a very common feature, and so how do I manage pain is a very common question. What kind of physical therapy would help me, or physiotherapy if you're in the UK? So for common questions, I can provide articles and information that really fits so many different people. But there are also a wide variety of questions that I may ever see once or twice in a year or in a lifetime because we're all so individual. I do spend a lot of time on Google Scholar looking for medical research articles to try and help answer questions that I may have been asked. That's part of the value of being able to handle the email portion of our helpline, because I have that time to research fully and answer to give them the most accurate information. We do have a phone line helpline as well, and I often think that would be more challenging.
Shani, you gave the statistics that 20% of the population has hypermobility, but only 1% of that demographic has EDS. Can you just,
Or less.
yeah, can you walk us through what some of the differences are between those two communities, just so that someone who's watching you right now might be like, oh, that's me that you're talking about, or actually, you know what, I'm probably in the hypermobile camp.
Sure. All right. So about 20% of the population, give or take, is hypermobile. Of course, young children, large percentage are hypermobile. As we get older, many people become more stiff, or at least not so hypermobile. But when you have a genetic condition like a type of Ehlers-Danlos syndrome, it's a connective tissue disorder, and so that's affecting the connective tissue all throughout the body. Yes, there's connective tissue in the ligaments and tendons, making us hypermobile because these tendons and ligaments stretch. But there's also connective tissue in other places of the body, like the GI system, from where food enters to where it exits. There's connective tissue in there, and those with a type of EDS can have a lot of GI issues. There is connective tissue in our eyes. And so those with a type of EDS may have a lot of eyesight issues. There's connective tissue in our skin. They may have fragile skin or extremely stretchy skin. Really, there's not many places in the body that does not have connective tissue that couldn't have a symptom caused by a type of EDS. That does not mean that if you have a type of EDS, you have symptoms in every body system and that you have every symptom that there's could be possibly had. It just means you could have symptoms anywhere in the body. If you're hypermobile, you tend to be able to have a larger range of motion than many of your peers. But you also actually may have joint pain, but you would be unlikely to have the systemic problems of having problems in so many different body systems at the same time as your hypermobility. Also, many people are hypermobile, but for instance, in hypermobile EDS, joint subluxations and joint dislocations are common. And so if you are a person who is hypermobile and you dislocate your shoulder or your patella or your hip, that's when you might want to look at a type of Ehlers-Danlos Syndrome or another condition that causes impacts to connective tissue.
How would people get assessed? How do they actually go about getting a diagnosis?
With so few in the medical community knowing about EDS, it's challenging. At this point, some patients are discovering EDS online through their own searches. When they're Googling what in the world is wrong with me, they're discovering it and taking that information to their doctor, while we are actively educating more and more doctors. And so some doctors are identifying patients now. But in general, it kind of depends where you live. In the UK, patients go to a rheumatologist. There are some great options in the UK if patients are seeing doctors through the NHS. Dr. Kazkaz is a great option in London. And if you're able to see physicians outside of the NHS privately, then Dr. Alan Hakim is also an excellent option. In many other countries, it's a geneticist, though, that you go to.
Sorry to ask a really quick question, but would you mind, just while we remember, could you email those doctor names to us so we can actually put it in the notes so people can Google those doctors, and if they need support, they can look them up. Thanks, Shani.
Sure will. In many other places in the world, including the US, Australia, Canada, you go to see a geneticist. These are genetic conditions, and a geneticist is who you would see. In the UK, if a rare type of EDS is suspected, the rheumatologist will refer you to a geneticist. But you start with a rheumatologist first.
So I'm curious, because a lot of the things that you described are things that we have discovered are, they come with just general joint hypermobility syndrome. How do you know if you just have like joint hypermobility, or if you're like all the way over onto the spectrum, like, because I think that the way that I'm understanding it is that it's kind of a spectrum, and so you've got like hypermobility, like where you're maybe a little bit hypermobile in certain joints and you have some symptoms, and then it kind of just increases the more hypermobile you are, the more symptoms that you have outside of, as well as the flexibility, basically. So the GI issues, the asthma, migraines, all of these other things that come with it, is more towards EDS, and the EDS is kind of that extreme side. How would you know if you sit, within the EDS side of the spectrum, or if you don't have EDS and you're just hypermobile?
Mm-hmm. I'm going to probably confuse you just a little bit more, I'm afraid. Joint hypermobility syndrome is now an outdated diagnosis. In 2017, the International Consortium on Ehlers-Danlos Syndromes and Related Disorders updated the nosology. They tightened the diagnostic criteria for each of the EDS types and they created a new diagnosis, hypermobility spectrum disorders.
Okay.
And they pretty much said, we're not going to use joint hypermobility syndrome any longer. Now, of course, not every doctor was notified of this. You know, it's incumbent on doctors to keep up with the latest research to know about this. So there are still people getting diagnosed with JHS. But in actuality, it's hypermobility spectrum disorders. And of those, there are several types, including historically hypermobile, but no longer, or hypermobile just in your fingers and toes, but not in your larger joints, and so forth. It actually does not follow that the more hypermobile you are, the more symptoms you have. There are people with less hypermobility that can be just as severe or more severe as somebody who displays extreme hypermobility.
Wow. And you're
So it
talking
doesn't follow in that.
with that, right? When you're talking about the levels of hypermobility, doesn't necessarily mean you're very, very, very flexible and then you have EDS at the end of the chain. It's like you could have EDS and not have that flexibility in your joints.
Hypermobility is a feature in almost all types of EDS. However, not every person with a type of EDS is extremely hypermobile.
Okay.
Does that make sense?
Yeah, thank you for clarifying.
So do you think more with like lifestyle and, you know, if somebody just has a lifestyle that means that they're not kind of putting their joints into a
risky
position. Maybe they're just very sedentary, or maybe they do something that's very, very strength training, strength based, so that does kind of help hold everything together a bit more, or is it actually a type of EDS that where the stretchy tissues are affected differently?
In general, because there's always exceptions, right? In general, those that have a type of EDS benefit from increasing their muscle tone so that when the muscles are at rest, they can still serve as a secondary support structure for joints, since the tendons and ligaments aren't doing a great job supporting those bones. For many people with a type of EDS, it can take a really long time to build up that muscle tone. It includes, you know, we don't really need to work on range of motion. We don't need to have greater hypermobility to, you know, as a goal. But there are poses in yoga. There are types of Pilates, and there are types of physical therapy that are appropriate for those with a type of EDS to increase their muscle tone and to work on a good posture of finding that center, of supporting their body in their daily tasks of moving, having a greater ability to be mindful in how you're bending and reaching, and a lot of those daily living tasks that can be problematic if your shoulder slips out every time you reach for something, right? And so there is a role in yoga. In general, it's not good for those with EDS to extend to the range of their motion. It's difficult because everyone wants to be great at something and shine, and many with a type of EDS can really shine in a yoga class. They can be, but we need to pull back a little. We need to not go to the extent of where we could go. We need to concentrate more on which muscles are we contracting, and building slowly the musculature around joints.
Oh, we're so happy that we're having this chat with you, because this is a message that Adell and I are really passionate about sharing with the world. And we feel like this message isn't being reinforced enough among the hypermobile community, and that encompasses obviously our EDS friends as well. So to hear someone like you that has so much knowledge and experience in working with these people say that, just really, well, it first of all helps us know that we're on the right path,
Yeah.
and then it's something really of value to share with these people, but also just to kind of add that credibility to our message. So we're so grateful to be having this chat with you, Shani. Thank you.
Sure.
You know, you've given some really beautiful strategies in terms of dealing with your physical body in range of motion and muscle tissue. But I know that a friend of mine has EDS, and she'll wake up with like her real bad eye problems, or she'll wake up with a rib that's dislocated, severe breathing issues. And this systemic issue that you're talking about,
Mm-hmm.
have you got any strategies that you feel has been really amazing at supporting people with more of the systemic issues that they face?
It can be really challenging when you wake up and your body has multiple symptoms going on. You know that you should be doing your exercises or your yoga poses or whatever, and you're not feeling well and you're not functioning well. My first advice is be forgiving of yourself. Know that you are trying your best, and that is good enough. Whenever you can, it's good to just do a little. If you're having to spend a lot of time in bed, there are exercises and poses that you can do in bed. If you're needing to be in a chair for much of the day, once every hour, you could do one or two exercises or gentle stretches, deep breathing exercises, and just work up from there. If you did 2 of these a day today, for every day this week, could you maybe do 3 next week? Could you maybe do an extra one every half hour instead of hour? It really takes a while to build up the muscle tone you need, but to also be able to tolerate doing these things when you've got so many symptoms going on, and you hurt and you have fatigue, it's really challenging. But if you just start with a little bit and increase at your own pace, you really can make progress in how you feel and function.
Just 1 second, because it just relates. Do you feel that the strength training then has an effect on the systemic issues?
Anytime that you can better manage one of the symptoms or problems that these conditions cause, you are going to feel and function better. Increasing muscle tone to support the joints will not necessarily improve the breathing issue. But if you're not having to deal with both the joint instability and the breathing issue, you can better tolerate and deal with the breathing issue.
Okay, that's
so it's not that doing exercises or yoga or these things will cure all of your symptoms and help you manage every symptom, but it can make you it can give you progress in areas so that you can concentrate on those areas where these strategies don't help, which may need you know, different therapies. It may need different medications or treatments. And that's based on each individual symptoms.
That totally makes sense. And so, yeah, it's just that reinforcing the idea that we are going to benefit if we keep moving a little bit every day, even if we don't feel like it, but B, not in a way that is in, you know, comparing ourselves to what other people are doing, because other people who don't have this disorder may be able to go all day just bouncing around full of energy. And it's important because I know for me it's really easy for me to start feeling down on myself about not having the energy levels as some of my friends, but as soon as I just ignore what they're doing and I focus on what makes me feel good, and I find that balance between getting up when I don't feel like it and doing a little bit of movement even though I feel tired, but then also knowing when, okay, I've done enough, I can stop again.
Mm-hmm.
It's really helpful, really important.
Right. Yeah. And this isn't a condition that generally responds well to pushing yourself to the limits or ignoring the pain and pushing through the pain and ignoring the pain. Those signals are telling us something, and we do need to listen to our bodies.
Yeah, so important. I think that this message, and for people to realize for the first time maybe that this is the reason that pushing themselves, because there's such a message out there in every movement community, I think, including yoga, about, you know, just keep pushing, like just get stronger, and
Right.
if you struggle, then you just need to like work harder. And you know, our society is so go 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 go, and it can be, I think, really life-changing for somebody to hear that actually that's not always right, and especially if you know that you have this disorder, then
it's empowering.
It's really empowering. Yeah.
Right. Knowing that not every pain, that when you're being active, it may hurt, you know, but sometimes that pain is telling us damage is currently happening. We need to stop that movement and adapt it, change the position or change how you're doing it, or replace it with a different movement. If your body is saying, no, this is causing me harm. I'm sorry, that's my dog. That happens every time a doorbell rings. I apologize. Not every pain means damage is occurring right now, so I don't want to send that message. But learning that pain may be signaling that damage is occurring, and that you should listen and not push. You should alter how you're doing that pose or that exercise. You should replace it with a different one. Whatever you need to do to not cause damage to yourself. It really is not a ignore all pain kind of condition. You can really damage yourself that way.
Also, Shani, you lightly touched upon the psychological. We've been talking about being kind to yourself. Is there anything else in terms of, I mean, we have done some research and we both have found that there's a strong correlation between hypermobility and anxiety. Is there anything in terms of mental health that is prevalent in the EDS community that you can share with us?
Sure. As with all chronic conditions, both depression and anxiety disorders are more common. It can be a little tricky in those that have EDS with anxiety, however, because of about 78% of us also have postural orthostatic tachycardia syndrome, also known as POTS, or another type of dysautonomia, an autonomic system dysfunction, comorbidly. And some of the symptoms that can cause mimics anxiety disorders.
Yes.
And so with a type of EDS, it's important to know, do you have a type of dysautonomia? Do you have an anxiety disorder, or do you have both? Because in our community, there's all of those. But to answer your question on mental health is so important. In our society, we don't really appreciate that taking care of our mental health is just as important as taking care of our physical health. It's not anything to be stigmatized. It's not anything to be ignored. And it deserves as much attention as we pay to our physical health. Developing strategies, becoming a tool collector of what to do when you are in crisis, when you're having a panic attack, or if you're feeling suicidal, to have tools that you can use, everything from visual imagery exercises to deep breathing exercises, to having a quick text number of a friend or a family member that you can reach out to if you need help, or even an organization that specializes in those that are having a panic attack or suicidal ideation. Many of us benefit from adding a mental health professional to our medical team. Not only does that help us learn coping skills for living with a lifelong condition, a challenging condition, but it also serves as when doctors want to try and blame symptoms on anxiety or some other mental health condition, the mental health professional can say, no, actually, that's a physical symptom that's in your ball court, you know. So it's valuable to add a mental health professional to your team too.
Can I just check? You mentioned POTS. That's when your heart races, right?
POTS is diagnosed when you go from laying to sitting or sitting to standing, that your heart rate increases at least 30 beats per minute, 40 beats per minute for children. There's other types of dysautonomia. For instance, I have orthostatic hypotension. My blood pressure drops when I stand or change positions, whereas my heart rate doesn't change at all. There's different types of dysautonomia. So POTS is one, and that you may feel a fast heartbeat. You may have dizziness, lightheadedness when you stand. You may have blurry vision or other signs that you're close to passing out, fainting, syncope when you stand. You may have actually fainted when you stand for some.
Yeah.
Okay, I have another question. It's kind of going back a little bit to when we were talking about the diagnosis of EDS, so that you know if you are simply somewhere else on the spectrum, or if you actually have EDS. And given what you said about how so many doctors maybe don't even know that joint hypermobility syndrome isn't a thing anymore, and it's been changed, and a lot of doctors don't even think about EDS as being a possibility when they see patients, do you think that actually there is a higher percentage of the population with EDS that we just don't know about it because it so often goes underdiagnosed or non-diagnosed?
Very good.
It's difficult. We truly do not know the true prevalence of the different EDS types and of the different types of hypermobility spectrum disorder. At this point, research is underway, we're trying hard to find that out. You know, it's on one hand, more people are being diagnosed than ever before. On the other hand, you have to know there are people out there that are living with this condition and don't know it, and are really questioning what it is that's wrong with them. You know, there's nothing wrong with them, but their doctors have just now not found yet what is causing their symptoms.
Yeah, and I'm thinking that it's got to be a good thing if more people who think that they might have EDS go and see a doctor and get that diagnosis, because the more people that get the diagnosis, then the more data that's out there for these the researchers and everybody, and the community to draw upon, right?
Exactly right. If I can go through a few different ways that would help. Excuse me. For anybody who is wondering if they have a type of EDS or hypermobility spectrum disorder, HSD, you can go to the Ehlers-Danlos Society's website at www.ehlers, Danlos, DANLOS.com. These doctors always name conditions after themselves, don't they? Where there's lots of information, including the diagnostic criteria for each of these types, so that you can see, do you maybe have this? But for those that are diagnosed, we have a patient registry that we're encouraging everybody that's diagnosed to join, because it's through the patient registry we'll really be able to see how many people have these conditions. How common is it? Is it more common than we think? We kind of think so, but until we really have those numbers, we can't say for sure. So joining the patient registry, for educating more doctors where we all live, we have recently launched Project EDS Echo, and this is kind of a virtual grand rounds that doctors can do to learn all about these conditions. We have flyers on our website that you can give to your doctors to invite them to participate in EDS Echo, so that you can have EDS knowledgeable doctors where you live too.
That's awesome.
Yeah, that's so helpful.
You're making such a positive impact in the community, Shani, with everything that you guys are doing and sharing. And is there anything else that we feel we need to kind of share with this community that could maybe help them?
Yeah, I just think it's really important, actually. I'm just thinking, like, listening to everything that you've said, Shani,
yeah, it's been amazing.
It's so important, because I think that also within the yoga community, hypermobility and EDS is also a lot higher than outside of it, because
right,
people love yoga, even though of course you don't have to be flexible to do yoga, but it is, I think, higher in the yoga community. And so I think that it should be highly encouraged for people who think that they might have this to go and see a professional and find out for sure.
And if you're a yoga
knowledge
teacher,
is power. Yeah.
If you are a yoga teacher, you know, really learn to look at your students, and, you know, if there is someone who is really, really flexible, you need to talk to these people and educate them, and, you know, not just about hypermobility, but the possibility that EDS might be a part of their diagnosis, and they need to look into that.
Yeah, but I'm just thinking about so many of the stories that people have when they come to yoga, and it's like, yoga helps me with my anxiety. Yoga helps me, or people in the yoga community are very sensitive, and they talk about, like, I'm a highly sensitive person, and these are all things that could be an indicator of EDS or hypermobility.
Absolutely. Shani, is there anything you wanted to share with this community, maybe the undiagnosed community, or, you know, something from your experience that you think this is a message that they should hear?
Sure. First, thank you so very much for having me. This has been such a joy. You are both wonderful.